कर दिया मैंने क्लिक. I guess this is just like that. Bismillahirrahmanirrahim. Rabbi shrah li sadri yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Starting with the name of Allah, the most magnificent and the most merciful. This is RJ Laraib and the show Healing Hours every Monday and Tuesday from 2 p.m. to 4 p.m. So, as we have entered third Ashra of Ramadan, and today is 21st of Ramadan, and I wish and I hope may Allah accept all of our supplications and prayers and ibadah. So, the topic for today is neurological disorders, and the guest today with me is Dr. Mohammed Assad Javed. He is neuro and spine surgeon, and he is serving as assistant professor of neurosurgery department at Dr. Akbar Niazi Hospital, Islamabad. Assalamu alaikum, sir.
Walaikum salam. Thank you very much for inviting me here.
You're always welcome, sir. How are you?
Alhamdulillah, I'm fine, and it's Ramadan, I'm doing good.
Okay. And what are your activities these days?
Usually, neurosurgeons are busy like every day in Ramadan. You're also busy, and
so you have hectic routine in Ramadan too?
Yeah, it's very hectic because due to Ramadan we have restricted hours of duty, and then we have to do surgery at night.
Okay.
Of course, it's a busy, schedule.
All right. So, sir, can I start asking some questions? Like, I would be starting from some personal experience first.
Okay, that's all right.
All right. So, sir, my first question is that how long have you been practicing neurosurgery?
Alhamdulillah, I'm been practicing neurosurgery for the last 15 years. After my graduation, I have done FCPS and FRCS in neurosurgery.
All right.
And then I started working at Akbar Niazi Teaching Hospital.
All right.
And it's been 7 years since my graduation. And before that, I started working neurosurgery right from 2010.
All right. So, what motivated you to choose this field?
Neurosurgery, it's a very difficult field,
yes.
Of course, and people think before coming to this field that it's very tough and very, kind of field where everyone cannot cope with the difficulties of the field. But to me, I like these difficulties, and I took them as a challenge, and that's why I came here into the field, and it's a very fantastic field, neurosurgery.
Yeah. All right. So, which areas do you focus on?
I'm focusing basically on minimally invasive brain and spine surgeries. I have a keen interest in doing endoscopic brain and spine surgeries.
Okay, all right. So, sir, moving on towards our questions regarding neurological disorders. So, my first question is that please define neurological and neurosurgery related problems.
Okay. As far as one thing, I will let you know that if you talk about some kind of neurological problems, they can arise from the brain and the spine as well, because they both are the parts of neurological system. So regarding the brain, the most common issues which people feel and pass through, going through these days is headache. Apart from that, most of the time they have some kind of loss of consciousness episodes, which usually we commonly call epilepsy.
Yes.
There are other disorders arising from the neurological tissues like brain tumors, which can be right from the brain tissues are covering of the brain. Apart from that, brain has the blood supply vessels.
Yes.
So there are problems which arise in the vascular system of the brain, which also presents symptoms which are very similar like any brain pathology. Apart from that, the brain has a water channel which is called the ventricular system.
Yes.
So any tumor, any problem in the CSF circulation also presents with symptoms which are more or less like a brain tumor. So these are the problems which arise from the brain. Talking about the spine, we have the cervical spine and the lumbar spine, which are the more mobile spine areas of the lumbocervical the system. So there are more problems in the neck ache and the backache. And the most common thing which usually we face nowadays is the disc herniation problem due to prolonged sitting,
yes.
Overweight, obesity.
All right. Okay, so how can these neurological disorders affect or impact quality of life of an individual?
They of course affect quality of life very badly. If we talk about the backache problem, if one is suffering from the back issues and there is disc herniation, the patient feels a lot of severe pain which radiates down the limb.
Yes.
And it makes him or her incapable of doing his daily life. And if we talk about the nerve pain, usually we feel pain, abdominal pain,
yes.
or any kind of other pain, but the pain which rises from the nerve is very severe.
All right.
and it's very debilitating. So if one's feel pain in the back and it's due to the nerve compression, that is very severe pain.
All right.
And it
Is
doesn't.
sciatica included in it?
Yeah, sciatica is basically the sciatic nerve which
Yes.
arises from the lumbar spine. So any compression over that nerve roots leads to back pain that radiates down the limb,
All
and
right.
it's called sciatica.
All
And
right.
it's a very severe pain.
All right. And sir, what is the importance of timely diagnosis and treatment in managing these conditions?
Well, we say that time is brain. If you diagnose the things on a proper time and treat them properly on a time, then there are more chances that you will save the neurological tissues. You will save the function of the neurological tissues.
All right.
So if one gets any disease, any brain problem, and he wastes time in going here and there and not taking the treatment advised by the neurosurgeon, he is actually losing that precious time in which he can get a good result if we go through that procedure of any operation or any treatment
Exactly.
plan.
Yes. Can you discuss some prevalent neurological disorders concisely?
Most of the time we are in OPD, we are usually looking at patients. We have headaches. Apart from that, we have neck pain problems, and apart from that, we have lumbar spine back problems, back issues, which are more commonly presented in OPDs nowadays.
All right.
So if we talk about the brain headache, so headache can be due to different causes, and one of the worst headache, this is called, that is due to the brain tumors.
All right.
Okay.
So why are brain tumors prevailing today?
Nowadays, I think there are different pathologies in case of brain tumors. It doesn't matter that whether you are from you are taking a good diet or something like that. It doesn't affect on your usually the brain tumor occurrence. They are related with your genetics and your exposure to radiation in early childhood. And apart from that, if you have some kind of genetic issues which can lead to development of these tumors. So of course, things are going on, and research is also being done on usage of these mobile phones, but
Exactly.
yet there is no some conclusive evidence that these radiations which is emitted by the phones, they cause brain tumors.
All right. So what are the primary factors or mechanisms behind this epilepsy or Parkinson's?
Okay, if we talk about the epilepsy and Parkinson's is altogether a different problem. Epilepsy
Yes.
is something else. So epilepsy, usually we call them mirgi ke jhatke, and they usually occur when there is malfunction of some brain parts. So it starts firing, and then the body starts jerking, and when the patient become unconscious, there is frothing of mouth, and there is
Yes.
urination that goes on. So the cause of epilepsy, if we talk about, there are multiple causes, and the brain tumor patient can also present with these symptoms. However, when there is nothing like that in the brain, that is called primary epilepsy, in which patient has dysfunctional neuronal tissues.
Okay.
And nowadays, a specific field of neurosurgery is dedicated to that epilepsy, that is called functional neurosurgery. And the patient who had different kind of epilepsies, they are treated by these domains of neurosurgery, functional neurosurgery.
So these are lifelong disease.
Of course, epilepsy is a lifelong disease, but nowadays there are different treatment options in which we resect a part of the brain which is causing the disturbance, and the patient can get cured from that surgical procedures.
All right, all right. So I'm moving towards the symptoms of these neurological disorders. So what are the most common symptoms?
Okay.
Like general symptoms and all. Then I'll come to specific symptoms.
As I told you that if the problem is inside the brain, the most common symptom is the headache.
All right.
And any problem which is causing increased pressure inside the brain leads to headache, along with vomiting and nausea, and there are also fits like seizures.
Your eyesight is also affected?
Yeah, of course, it depends upon the location of the tumor. If it's located near the visual pathways, then of course the patient develops weakness in the vision as well.
All right. So now please discuss some motor symptoms.
Mm-hmm.
So what are some motor symptoms?
Motor symptoms, because each part of the brain is very specifically located for each body function. So when there is a tumor or something inside that part of the brain which controls your movements of the limbs, and that's the patient present with weakness in the upper or the lower limbs.
Okay.
So it's the motor symptoms which are usually they comes later on. Initially the patient feel symptoms of increased ICP, raised intracranial pressure,
Okay.
and these are the headache and vomiting. And if that tumor is near with that motor strip, then the patient develops any weakness in upper or lower limbs on the opposite side of the brain.
Why it increases blood pressure too?
Of course, when there is increased intracranial pressure,
Okay.
to keep the blood circulation to the brain constant, the heart rate generates a lot of other pressure, so
Okay.
blood pressure also increases.
So motor symptoms are like tingling, cramping, and
Yeah,
numbing.
tingling, cramping, they are more related with the spine problems.
Okay.
As far as the brain problem is concerned, usually the patient have these symptoms like headache, vomiting, any motor weakness.
Alright.
And if the problem is inside the cervical spine, then usually the problem develops in the hands. Then you feel any numbness or weakness in your both of the hands or on one side.
Alright.
Similarly, if the problem is inside the lumbar or thoracic spine, then usually the lower limbs are the
Affected.
initially
Okay.
affected.
Okay. And what are the sensory symptoms?
Sensory symptoms depends upon the location of the tumor. Sensory symptoms usually these are the sensations which, apart from that motor weakness and distress sensation, you feel some kind of abnormal, the smell,
Okay.
abnormal tingling in your ears, and abnormal sensation on your hands. When there are not things and you feel that something is
Alright.
moving on. Yes.
Alright.
And there are visual hallucinations as well when you see something which is not there. So
Okay.
these sensations are also disturbed when there is problem inside the neurological
Alright.
system.
Alright. And what about cognitive and behavioral symptoms?
Again, I will say that cognition and behavioral symptoms, of course, they are being disturbed by the brain pathologies, but it depends upon the location of the tumor again. So your frontal lobe of the brain, which usually controls the cognition and your personality and your thought process and your judgment, when there is pathology in those frontal lobes, yes, of course, you develop a problem in your thinking, in your judgment, in your urine control. So things change when there are tumors in the frontal lobe.
Alright.
However, the tumors in the occipital lobe, temporal lobe, they have other symptoms.
So is there like symptoms vary between individuals?
Majority of the time, brain pathologies usually present with three main symptoms: headache, vomiting, and fits.
Alright.
Apart from that, then depends upon the location of the tumor.
Alright.
Then they vary symptoms.
So what are some diagnostic criteria?
Usually, when the patient presents with a headache which is not relieving, getting better for the last 3 months, 3 to 6 months, and usually it occurs at early morning times,
Okay.
and that is associated with vomiting. So that is suggestive of some kind of sensitive pathology inside the brain.
Alright. Alright. Okay, sir. So what are some common challenges or pitfalls in diagnosing neurological disorders?
Usually, most of the time in our communities, when the patient develops these kind of symptoms which are neurological related, they think that they are captured by some genes or something
Yes,
like this.
exactly.
So they don't go to the doctors, rather they go to the peer fakir and they get treated over there. And the precious time which doctor can diagnose and treat that patient, it is lost in those treatments.
Exactly.
So I think usually the patient don't come to us directly when they get these symptoms. But I would like to tell all the audience that if someone feels headache which is worsening with the time and which is associated with vomiting and which occurs mostly in the early hours time, one has to get to the doctor and take some advice.
And I think there is some stigma associated with neurological disorders. Like people think that if they go to doctor, they'll die ultimately.
Yeah,
Because of
exactly.
invasive surgeries and all.
Yeah. Most of the time, the people are afraid of the operations,
Yes.
and they think, and the doctor tell them that they need a surgery. They just
They avoid
vanish.
it. Yes.
They avoid it and at any cost.
Exactly. So what is the approach for differential diagnosis?
When you see patients regularly on a prolonged period of time, then of course you can just tell by the look of the patient that which disease he or she is suffering from. Apart from that, you have to take a thorough history, because
Alright.
multiple problems can have the same symptoms. Like if you have problem in your eyes, you can get headache. If you have problem in your ears, you can get headache. Or is there any problem with your sinuses, then you can get headache. So the doctor should be very attentive while taking the history to dig out the actual problem from which the patient is suffering from. And the things doesn't come in a one day time. You have to you have to spend your
Exactly.
whole of life to
Because
learn that.
symptoms overlap
Yeah,
and
exactly. So the first thing which is start to the medical student is history taking, which is very important.
Yes,
And 70 to 80% of the disease in this diagnosed by,
misdiagnosed, exactly.
yeah, if you don't take any proper history, then yes, you can misdiagnose the patient, and if you take it properly, then 80 to 90% of the disease diagnosis is done by the history taking.
All right. So are all the diagnostic procedures available in Pakistan
Yeah, Alhamdulillah.
easily?
Not easily, but of course there are big centers which have all the diagnostic, modalities which are there, being are there.
So are they costly?
Most of the time, the first diagnostic modality is the magnetic resonance image (MRI)
Yes.
of the brain or spine of whichever area is being involved. So that is not too much costly, and there are centers which are being supported by the governments.
All right.
So I mean, it's not costly. You have to go there. You have to just meet the doctor, and then he will advise you, treatment and an investigation plan.
So how do you decide most appropriate treatment option?
Well, again, it's depend upon many factors.
All right.
First of all, depends upon the age of the patient. If a patient with a brain tumor, he is 80-year-old, and if we go in and we take the tumor and there is no benefit out of that surgery, then it's better to don't do any surgery and just give the medication. And again, if the tumor is small, there is no use of going in and taking out the tumor. And if the tumor is located at an area which is very difficult to approach, then it's of no use to go and take up the tumor. So we basically individualize treatment plans to each patient. It isn't like that we have a plan and the patient comes and we follow those steps. So it
Okay.
is being changed by the patient representations, the patient other comorbids, along with the tumors specifically areas and the other pathology of the tumors.
All right. Sir, would you like to discuss traumatic brain injury? Its
Yeah, in
causes.
Pakistan and in third world countries, traumatic brain injury is on the
Very
top of,
common,
yeah,
yes.
very common, because of not wearing helmets and overspeeding and one wheeling, and the young patients, and
Yes.
they present to us with severe head injuries and the severe spine injuries, which get them paralyzed for whole of their life, and that's that they are burden for the community and their
Families.
family as well.
Mostly.
So head injuries specifically, along with the spine injuries, I have talked on many forums about this, but our people don't listen,
No.
and we get every day the young patient with severe head injuries and spine injuries, in which, of course, again, this is the matter of time. If a patient with a head injury presents you on a time, proper time, and we just do the surgery on a time, then there are more chances that he will survive and he will become functional again. But if it occurs in some remote areas and it takes much time to come to the neurological center to be diagnosed and treated, then of course the outcome is different as compared to the.
So people recover from traumatic brain injury?
Depends upon the the
Severity?
again, yes, severity of the injury. If it's mild and moderate head injury, then of course there is
Okay.
full recovery. In case of severe head injuries, recovery is possible. It takes a bit longer time. However, the mortality is increased in case of severe head injuries.
All right. Sir, memory loss is associated with certain neurological disorders.
Yeah.
So is that recoverable?
Memory loss specifically related to trauma, that sometimes is recoverable.
Okay.
But there are other diseases which is called dementias,
Yes.
Parkinson's disease, vascular dementias. So it's very difficult to retrieve those memories back, because
Right.
basically the problem is with these neurotransmitters. So when there is disbalance in the neurotransmitters, so memories are not stored and they are not retrieved. So there are different diseases and there are different outcome along with each disease.
Okay. So would you like to discuss Alzheimer's disease?
Alzheimer's disease, of course, is a basic the major thing which you heard about any memory problem when people thinks that they have Alzheimer's disease.
Yes.
Of course, there are different things which which you see in normal people as well, but dementia is the severe form of memory loss.
All right.
At times, one's doesn't remember about the person's name or any
Yes.
location, or sometimes you forget your own keys. Or this is not Alzheimer's disease. So Alzheimer is basically that disease in which you get the memory loss, which affects your life. You cannot remember your own home address. You cannot remember how to dress. You cannot remember how to take food.
Yes. Motor functions are affected, I guess.
Yeah, motor functions are more affected in
And,
Alzheimer's
and
disease.
listen that in some severe cases you're not able to operate like even remote.
Exactly. When
Yes.
there is more Alzheimer disease, it's a progressive decline of your learned memory. When you don't know how to dress, don't know how to wear your shoes,
All right.
and these all functional loss. So basically, Alzheimer disease is a severe form of the dementia or
Dementia.
memory loss.
All
Yes.
right. So what are the causes of Alzheimer's disease?
Alzheimer disease, basically, as we are approaching number one in diabetes. So diabetes causes small vessel disease along with hypertension and obesity and not doing exercise. Apart from that, cigarette smoking, tobacco use, and some kind of hereditary problems. These are the major factors which, and also if you have a stressful life, these are the major factors which lead to the development of Alzheimer
So
disease.
what measures should be taken by diabetic patients to
Well,
avoid this disease?
for every diabetic patient, diabetes control is the must thing,
All right.
and you have to do it with the help of medication and exercise and restricted, intake of sweets and all those things. Apart from that, to be in a good shape, you have to do regular exercise, specifically for the diabetes as well as for the general population as well.
All right. So can emotional disturbance cause Alzheimer's disease?
Not most of the time, because stress is not related with the development of Alzheimer disease.
Okay.
However, when someone is stressed for a prolonged period of time, he get diabetes, he get hypertension. So then this leads to the development of Alzheimer disease
All
as
right.
well.
So can a baby, a
Mhm.
newborn baby, have these neurological disorders?
Yes, neurological disorders in babies is the most common in Pakistan
Okay.
with a swelling which is called phoda on the back. When the baby is born, he develops a swelling on the back, which is basically the protrusion of the neurological tissue, and that's lead to the development of lower limb weakness. Apart from that, those babies also have big heads due to the accumulation of CSF inside their skull. So these are the most common problems
So why
with
are they
which
encountered? Why this happen?
the one thing which is really associated with development of these problem in babies is the lack of folic acid in mother's diet.
All right.
So whenever we diagnose or we come across these patients, we definitely start the mother on folic acid. Along with that, we also advise them to also spread the words of using of this folic acid in the neighborhood and along with their relatives as well, because there are more chances of development of the other fetus with this same pathology.
Alright, so what is the management in babies?
Usually, whenever such child is basically diagnosed before the birth on antenatal and anomaly scans. So when the baby is born, we just close that deformity on the back, and those nervous tissues which are passing through that sac, the swelling, we just preserve them to keep the lower limb, motor activity intact. So the best thing is to do the surgery within 3 days, 72 hours. Okay. And if that thing get ruptured, because it's a very thinly covered sac, so it get ruptured, then it's emergency. You have to do surgery on emergency basis, because then the germs get into the nervous system and the patient get meningitis.
So is there any phenomena of relapse in this condition?
No, there is no such phenomena of relapse, because we usually take all the sac out and we close the skin very meticulously. So there are no chances of development of that sac again, meningomyelocele or meningocele.
All right. So is he affected in his life?
Yeah, majority of the patient who have these symptoms, usually they don't have power in the lower limbs.
Okay.
Along with that, they don't have the controlling power of their urine and bowel habits. So apart from that lower limb weakness, they don't have control over the sphincters.
So what is their life expectancy?
Life expectancy, of course, it's good. They live longer, but with these things, they get infections and they get urinary problems and the kidney problems. So usually, I have seen patients they go on 40 plus.
Oh, mashallah. It's
That's not mashallah thing, but yeah.
No,
yeah,
I was expecting 11 years or 12 years of age.
No, because nowadays treatment is, the people bring their child and youths for treatment. So then if we treat them, then of course their life expectancy is long, and if they don't get treated, then of course they will die in a first year or second year due to that.
Because in case of
problems.
brain tumors, I've heard about relapse.
Brain tumors, again, I will say that there are different kinds of brain tumors. Glioma is, of course, if it's grade 3 or 4, there are more chances of recurrence.
Okay.
And if it's a benign thing, just like meningioma or grade 1 2 tumors, so there are least chances that they will recur.
All right, all right. So, is there any management given to that patient after surgery? Any precautionary measures?
Babies?
Yes.
Of course, we just tell them that you have to do the dressing and you have to keep the wound dry, and you also have to look for the increase in the head size, because usually majority of these patients also develop hydrocephalus. Hydrocephalus is a disease in which there is accumulation of CSF inside the brain. So we also tell them that they have to see the size of the head. So whether it start growing, then they have to bring the child back, and that's need separate surgery as well.
All right, all right. So is that surgery safe?
Yeah, of course, both surgeries are safe.
So like babies can tolerate 2 surgeries?
At times we do both surgeries on a single setting. If the patient is having a problem in the brain and the spine as well, we do both surgeries on a single setting. So if they have the problem, then of course we do surgeries in the same setting, and if they don't have the problem inside the brain at the time of spine surgery, then of course we do that surgery after a couple of weeks, 3-4 days after the main surgery. Yes.
All right. So sir, can you discuss any minimally invasive techniques or approaches you utilize in your practice?
Alhamdulillah, at Akbar Niazi Teaching Hospital, I started the minimally invasive surgeries. Currently, I am doing endoscopic spine surgeries. Usually, people do it open, and I do it with minimally invasive with 1.5 to 2 centimeter cut. I do with the help of endoscope, the disc surgeries. Apart from that, we have the endoscope, which we are using inside the brain for the hydrocephalus. Hydrocephalus is a problem in which CSF accumulates, and there is a question in which we put a tube, shunting. So we have adopted a new method of treatment, which is endoscopic third ventriculostomy. We go in with a single small burr hole, and we do and open up the channels which are blocked. So those patients don't need such kind of tubing. We be shunting them. And apart from that, I am also doing endoscopic MVDs. MVD, trigeminal neuralgia, is a disease in which the patient feels severe debilitating pain in the face, and for that we have to separate the trigeminal nerve from the vessel. So I'm doing that with the help of endoscope as well.
That's great. That's great. All right. So, what are some key considerations in providing comprehensive care for patients undergoing neurosurgical treatment?
So, whenever that's my habit. Whenever a patient presents to me, I usually start with the basic demographics, and then I go through whole of the history. Basically, concentrate on the history to look for the other associated problem. Because if the patient presents to you with some kind of back problem or brain problem, he's definitely suffering from other problems as well, like diabetes, hypertension, some kind of social stresses. Yeah, exactly. So I just my approach is holistic. I just treat them all. That's not the thing that I just treat the back and then the patient is being there with other problems as well. So I just thoroughly go through the history and dig out the other problem which the patient is suffering from to treat them as well in the same setting.
So after the removal of brain tumors, radiations are required. So are they required in all patients?
Well, it depends upon the histopathology. When we take out the brain tumor tissue and we send it to lab, and then they tell us that which grade is the tumor of. If the tumor is of grade 3 or 4, then of course the patient needs radiation therapy.
All right. Yeah. So you have interaction with people, like daily, in 24 hours you have interaction with people. So do they get on your nerves?
Yeah, of course. A lot of people, not the patient, their attendants, they are very fussy, and
they don't want to understand.
Yeah, they don't want to understand, and they make a fuss out of little things. So at times they become,
So how do you handle that? Any experience you would like to share?
Yeah, I will let you know that the patient just a few hours before coming here, a patient came to me,
Okay.
He was suffering from backache, and then the lady was also with him. I told them that he needs, the problem was for the last 6 months, so he needs some investigation. So then the lady became angry, and she said that, how kind of doctor are you? Are you sending us for investigation? You just check our pulse and tell us that from which disease he's suffering and what treatment he needs. So I told that I'm not a, what you call them, Hakim.
Yes.
I'm a doctor, so the patient needs these kind of investigation to diagnose the problem. So then she said, "Oh, we don't like you, and
Because they
we will
want to
take
skip
treatment from other
diagnosis.
doctor." Yeah,
Yes.
exactly. So people like this, they usually come to OPDs, and it's very difficult to just make them understand that, of course, your patient, you need this kind of investigation or treatment. But I will focus here that I will tell her that a doctor must be very polite, and
Yes.
of course he should explain all the things to the patient and make them understand, because they are not at that level of understanding, and
Exactly.
they are also
Exactly.
stressed. So one have to keep anger at, and don't be angry with the patients.
All right. Can you please talk about supplements? Is supplementation like nutraceuticals effective in neurological disorders?
In my opinion, it's sort of other business. you know, the effectiveness is, of course, it's very controversial.
All right.
And of course, if one's diet is good and he takes good exercise, and it's a balanced diet, then there is no need of such supplements. But at times, of course, neurological patients, when there is problem with the nerves, and nerve coating is made of vitamin B complex
Yes.
and vitamin C and these things. So I do prescribe multivitamins, but of course I also advise the patient to take a good diet, because these are just supplements, and the main thing is your diet, and you're taking good exercise.
Okay. So what is the good in diet?
Well, I will say, mm, good diet is not about a single thing.
All right.
Yes, you have to take meat, you have to take fish, you have to take eggs, you have to take plenty of fresh fruits,
All
you
right.
have to take a lot of water to get
Because
hydrated.
mostly ketogenic diet is prescribed in
Yeah,
epilepsy.
one thing which I forget to tell you
Yes.
about epilepsy treatment is the ketogenic diet,
Yes.
in which one have to avoid from all the sugary diets.
Yes.
And the main focus should be on the diet from the milk and the yogurt and these your oil. So this kind of diet is called a ketogenic diet, and of course that diet is very helpful in controlling the uh, symptoms of epilepsy. And I do prescribe this kind of diet to the patient which are suffering from primary epilepsy.
So does it have certain drawbacks, this diet?
Ketogenic diet, of course, it has some kind of drawbacks, but it's not for everyone.
Because
People
yes.
also use it for weight loss.
Yes,
But
exactly.
yeah, and then doing the weight loss, you miss a lot of essential amino acids and other things, which later on can cause problems.
Exactly. Sir, is stroke also a neurological disorder? Can you please
Yes,
shed
yes.
light on it,
Yeah,
please?
stroke has two types of strokes. When there is one type of that is hemorrhagic stroke,
Yes.
when there is rupture of blood vessel. The other type is ischemic stroke, when there is blockage of that vessel which is supplying the brain tissue.
Okay.
So these are neurological emergencies, I would call them. And nowadays we are getting an injection, TPA,
Okay.
and for in majority of the patients, 70% patient have ischemic stroke.
All right.
So if a patient develops symptoms of stroke, if he develops headache, vomiting, and any paralysis in the limbs, he definitely rush to the hospital, and that injection that stops that stop that clot and dissolve it, and the patient recovers from those symptoms of paralysis. So the time period from development to reaching the hospital is 3.5 hours.
Okay.
So in that period, if you take the patient to that hospital in which TPA is available, within 3.5 hours, yes, of course, the symptoms of stroke can be reversed. The other type of stroke, which is hemorrhagic stroke, when there is accumulation of hematoma, blood inside the brain due to rupture of some blood vessels, that kind of stroke needs surgery at times.
All
So
right.
in both cases, when the patient develops symptoms, they should be taken to the hospital immediately, and then on the CT scan we decide what kind of stroke is this and what treatment modalities preferred for each patient.
All right. So you talked about TPA. So is it easily available in every hospital?
Yeah, government is providing in main hospitals nowadays tissue plasminogen activator.
Yes.
It basically dissolves the clot, and majority of the hospitals in federal hospitals this is available.
All right. All right. So my next question is like, how do you involve patients and their families in decision-making process, like particularly for complex or high-risk procedures?
Well, in Pakistan, it's not the habits of doctor to tell the treatment plans to the patient and attendants. But for me, I have been through international courses and other things,
Alright.
and I do tell my patients and their families about the disease, about the different treatment options, and the complication associated with the option. And that is very much necessary to tell them about each and everything. Then I let them decide to choose one of them, and of course I help them to choose which is right for them. But it's better to tell them everything.
Sir, what about physiotherapy? Like, is it effective?
Physiotherapy, yes, that's effective. In case of we have problems with the spine, specifically the neck problems and the lumbar spine problem. Uh, Majority of the time, when the patient present in the early symptoms, then yes, of course, we prescribe them with the medication and physiotherapy over the period of 4 weeks, and at times it's very helpful to get the things back to normal.
All right. Sir, we haven't discussed Parkinson's disease, so please shed light on that too.
Yeah, Parkinson disease is again a degenerative disease. It's not some kind of disease that occurs in an early age. It's occur usually in after 50s.
All right.
And majority of the patients will develop this disease, this degeneration inside the brain, are diabetics, they are hypertensive, they have some kind of previous history of any trauma to the brain. So usually, patient with Parkinson's disease develops. First of all, they develop tremors in their hands.
Okay.
When they are sitting, their hands are shaking, and the next thing they notice, the other people notice, then when they walk around, they don't move their upper limbs. They just go in small, short steps, and they go straight. And it's very difficult for them to take turns. And apart from that, later on the period of time when the disease progresses, the patient have a mask-like face. When you tell them some jokes or some bad news, they have a similar face. They don't show any reactions, and most of the time they have other cognitive problems as well.
They become expressionless.
Yeah, mask face, expressionless.
All right. All right. So, what are the causes of Parkinson's disease?
Again, I'll tell you that Parkinson's disease, there is some primary Parkinson's and there is secondary Parkinson's.
All right.
Primary Parkinson's disease is genetically. It's not that everyone gets that Parkinson's disease. However, the secondary Parkinson's disease, which is due to comorbids, hypertension, diabetes, any previous surgery, any previous head injuries. So there are two different things, and they have their own different modalities.
Um, uh, does it happen because of some damage to certain part of brain?
Yeah, of course. If we talk about the Parkinson disease, there is the cardiac nucleus and some tension area.
Okay.
When there is a decrease in a hormone which is called dopamine, is decreased in some specific areas of the brain. So then there is decreased activity.
Okay.
That activity leads to then decreased activity in your limbs, and there is tremors in your hands.
All
And
right.
there are drugs which are being given to increase the level of their transmitters. So when you get these drugs and the transmitter level is increased, so you become normal. So whenever there's the drug effects goes down, you again develop the symptoms.
So this too is a lifelong disease.
Yeah, of course, it's a lifelong disease, and there is a new treatment modality which is called DBS,
Okay.
deep brain stimulation, in which we do small opening inside the brain, and we target the specific areas where that neurotransmitter is deficient. So we charge that area with some electrocurrents, and the things again start working, and the patient feels better.
All right. Sir, we have discussed nutraceuticals and physiotherapy related to neurological disorders, like they are effective to some extent.
Yeah, of
So,
course, to some extent.
what about psychotherapy?
Psychotherapy, of course, if a patient has some kind of disease, there are chances that the patient will get depressed over the period of time, specifically if one's hear that he's suffering from some kind of brain tumor or spine tumor, then of course he thinks that I'm going to die.
Yes.
So that make him depressed. So psychotherapy is very important for such patients, and we have a specific department for our own patients at Akbar Niazi Hospital. Specifically for the brain tumors patients, we do
recommend people.
Rather, we do involve our psychiatrists in their treatment plans.
All right. So you have a healthcare team.
Yeah, of course, we have a healthcare team. A patient who present to us with the brain tumors, and before and after the surgery, we do consult a psychotherapist for their better mental health.
All right. So can you please tell about that healthcare team you're talking about at your hospital?
Yeah, of course. I'm talking about my health team is included neurosurgeons. That's I'm leading that team. Apart from that, we have a psychologist and the psychiatrist. And apart from that, we have nutritionist on our board that tells them about that diet, which is ketogenic diet.
So what about the follow-up of the patients? How do you observe that?
Usually patients, because when you develop a rapport with a patient, then of course they come back and tell you about their progress. So first of all, when the patient comes to you, you have to make a rapport with the patient. Apart from that, because our people are restricted to going to one hospital. Once they go out of the hospital and you don't have the proper rapport with the patient, they go to some other doctor or to some other treatment facility. So that follow-up is, we cannot tell and we cannot, guard that the patient will come back to us. The majority of the patient, if you have a good rapport with them, of course they come back to you and they bring other patients as well. If they think that the doctor is good and he's trustworthy and he treats us well, then of course they come back.
Do you remember any optimistic patient?
Well, I'll let you know about a story. It's not a story; it's actual. There was a young guy who got an accident, who had a severe head injury. He remained on the vent for at least 1.5 months in a hospital.
Okay.
Then the family decided that we will arrange a vent care at their home.
Okay.
So again, the patient remained on the vent in their home for another 6 months. And the family took care of that, and I also visited them at their home as well. And later on, I just lost the follow-up, and some other doctor was there. But one day I went there, and I was offering care, and the uncle who was sitting next to me, the patient father, he just recognized me, and then he thanked me, and he told me that my son is now, alhamdulillah, is awake, and he's now started living again a normal life. And then we went to his home and then met with that young chap, and alhamdulillah he was in a good shape. Of course there was some problem with some kind of thinking and memory, but yet coming from that comatose condition to your talking state again, that was very miraculous. And of course I do believe in if you think good things happen to you, and if you think bad, then of course there is energy into the universe that gets you. Yeah.
How many years you have invested in this field?
Well, right from 2010, I'm in the field, and it's an ongoing process. It's going on.
Okay. So, yeah. Sir, I would like you to discuss more success stories to motivate our listeners.
Well, I'll talk about. I have multiple stories, specifically the pathologies involving the brain, and especially the brain tumors. I have a Facebook page actually, and I have shared many of those stories on that page, to motivate the people and just to get them know that not every brain tumor is killing, not every brain surgery is killing. Of course, a patient do cured with these surgeries as well. So for the people, brain surgeries are very difficult to just hear about or just do it.
Exactly.
But for the neurosurgeons, because we are doing it on a regular basis, and we are very confident about the prognosis as well. If someone is interested and wants to know about the patient stories, I have a separate Facebook page. Of course, I will. One of them, I recently operated upon a lady who had a big tumor in the hindbrain, just behind the ear, and she was suffering from that headache, vomiting, and she was unable to move around. and there was decreased hearing her on the right ear. So she went to multiple doctors, and of course she was afraid to undergo that surgical procedure. But yet I just consult her and tell her about the other stories as well, and then she got ready for the surgery. Alhamdulillah, the surgery was a successful surgery, and she recovered from that. We removed whole of that tumor, and Alhamdulillah, she's fine, and she comes to me happily for the follow-ups as well.
That's great. That's great. All right. So, what is the future of neurosurgery in Pakistan?
Alhamdulillah, I'm looking for a bright future, and Alhamdulillah, we will bring newer technologies, and we will move towards non-invasive, minimally invasive surgeries techniques, inshallah, in the futures.
Okay. Sir, you encountered deaths too. So, does that affect you emotionally?
In the start of my career, yes, they were very, I mean, it's very depressing to see someone dying in front of you, especially the young ones and loved ones. But later on, when you become accustomed to that thing, it doesn't hurt you a lot. But yet, of course, every soul has a different feeling for you, and that, of course, if death occurs in front of you, it doesn't hurt you.
Exactly. Okay. So, what is the availability of neurosurgery procedures in Pakistan, and what is the financial burden?
Well, thanks to the government, due to the health card, majority of the surgeries are being done freely.
Okay.
Of course, surgical procedures are very costly if you go for some kind of spinal fixations or disc replacement or
Okay.
some kind of implant procedures. So they are very costly. But nowadays, due to the provision of that health program, majority of the patients are getting them free, and majority of the centers in Pakistan are now doing the neurosurgeries.
All right.
Yeah.
Sir, you talked about disc herniation.
Yes.
So, what is that?
Disc herniation, basically, in the spine we have vertebras, and among the two vertebras there is a viscous structure,
Okay.
disc, which is called just like a spring. It just absorbs the pressure.
Okay.
So when there is overload, when there is more pressure than its resilience, then it gets ruptured,
Okay.
and some of the material of the disc goes into the spinal canal from where that spinal cord is passing through. So it goes inside that canal, and it impinges upon that nerve roots which is going through down the limbs.
All right.
So it causes severe back pain, then the pain radiates down the limb, and it makes life very miserable because one cannot move around, one cannot bend, one cannot offer prayers. So and there is burning of the feet, or any numbness or any weakness in the lower limb. So this problem is very common nowadays because of our lifestyle changes. We don't do exercise most of the time. We are sitting, or improper lifting of weights that lead to the disc herniation.
So, the treatment option for it is only surgery?
Not only surgery, as I told you before, that when patient comes to us, we assess the patient severity of symptom. Then we do prescribe a test, MRI, and then we see the stage of the disc herniation. Majority of the time, if the patient pain is bearable, then we prescribe him medication and physiotherapy for 3 or 4 weeks. Then again we reassess them. And if the patient is getting better, of course, we continue this treatment for 3 to 4 months. However, if the patient has some kind of neurological deficit in the lower limbs, there is any problem with the urination control, there is severe pain which is not responding to the medication for the last 3 months, then of course we do surgeries.
Okay.
And nowadays, alhamdulillah, there are minimally invasive surgeries in which we make a small cut, and through the help of camera we take out that portion of the disc which is inside the spinal canal. So the patient immediately gets relief. Yesterday, 2 days before, a patient came from Saudi.
Okay.
He had severe back pain that was radiating down the limb, and he was advised surgery in Saudi Arabia, but he came here.
Okay.
And after coming to Pakistan, right from the airport, he came to the hospital, and then I saw him, I advised him surgery, and then after talking to the family, he get ready for the surgery, and after 3 to 4 hours when the surgery, he was awake from anesthesia, he was fine.
Okay.
And we discharged that patient after 4 or 5 hours of surgery. And he was very happy because there was so much pain that he was unable to stand or sit quietly.
All right.
So he was very thankful. So surgeries are, of course, very helpful for getting the patient back to their normal life.
Okay, okay. So it means you're a great doctor.
Every doctor is great if he's doing great work. Alhamdulillah, there are other doctors as well. But alhamdulillah, I feel myself lucky
Mashallah, yes.
to to help people.
Okay. Sir, what are some main challenges you encounter in managing patients with neurological disorders? Main challenges.
Well, main challenges is the provision of post-operative care.
Okay.
I can do an excellent surgery, but I cannot stay with the patient for 24 hours. For that we have to have good ICU care, we have to have good nursing care. So the main challenges are post-operative care in Pakistan specifically. If we move to the government setup, you see, and people are lying on the stretchers. They don't have the beds, and there are limited number of nurses. So it's very difficult for the patient and the attendants to take care of those patients who are in comatose condition. So post-operative care and ICU care, specifically and nursing care, these are the big challenges which can turn your successful surgery into failure.
All right. All right. So, sir, how do you stay informed about new developments and best practices in this field?
Yeah, that's the very important thing. To be in the good, you have to be evidence-based medicine. You have to take part in the daily and newer activities as well. I usually do workshops on a regular basis, both national and international, alhamdulillah.
Right.
And I also take part in our monthly meetings. We have weekly journal clubs. So and also I do research on the patients which we are doing. So to be in good knowledgeable shape, you have to go all through these things.
So, do you publish case reports?
Yeah, I have published a lot of case reports, and currently I am working on 4 different articles about different treatment options.
All right, all right. So, sir, thank you so much for giving us time, and it was a really informative session with you. And
thank you very much for you guys as well.
No, sir.
For
thank you so much for the time, sir.
Thank you very much.
I hope that listeners would have enjoyed it too.
Yeah.
So, sir, any takeaway points?
Takeaway points for the youth is to avoid one wheeling and to wear helmets and to obey the rules.
All right, all right.
And if someone is suffering from any brain pathology, with help of a qualified neurosurgeon.
All right. Instead of treating themselves.
Yeah, exactly.
And going to the quacks.
Exactly.
And those
exactly.
All right, sir. Thank you so much.
Welcome.
All right, listeners. This is Laraib signing off, and I'll meet you tomorrow, inshallah, right at 2 p.m. So take care. Allah Hafiz.